Iron is an essential mineral that gives you strength and endurance. It is highly needed, especially by physically active people such as athletes. But what if this one important nutrient drops and you suddenly run out of it? It's exactly what we're going to talk about in a bit. Iron deficiency anemia happens when your body doesn't have enough red blood cells. These red blood cells carry oxygen to different parts of the body to keep them functioning well. A substance in red blood cells called hemoglobin gives the red color to your blood, and it enables RBC to carry the oxygen from your lungs to your cells and tissues. Meanwhile, iron is a mineral needed by RBC during this process, and if your brain and other body organs do not receive oxygen, they may not function properly and it can lead to anemia. In this video, we'll talk about the signs and symptoms of iron deficiency anemia or IDA that you should pay attention to. Number 1. Fatigue. Do you easily get tired even after doing simple tasks? You better pause for a moment and check why this happens. Extreme fatigue is a common sign of iron deficiency anemia. This is an early sign that most anemic people experience. Without an adequate supply of oxygen in your body, you will have decreased energy, which may lead to tiredness or weakness. If this feeling becomes persistent, even after rest or sleep, consider checking with your doctor if you're iron deficient. If you're indeed iron deficient, try modifying your diet and start consuming iron-rich foods such as beef, chicken, eggs, and anything that involves red meat. Just be careful not to eat too much of it because red meat also contains unhealthy fats. Other signs that may be associated with fatigue are dizziness and headaches due to depleted energy. Number 2. Pale skin and eyelids. If you don't have enough red blood cells, your skin and inner eyelids may look pale. You must have seen doctors stretching the bottom part of the eye when checking symptoms of anemia. Paleness of the skin and eyelids, also called pallor, happens when the blood shunts away from your skin and tissues. Besides red meat, you may eat green and leafy vegetables that are high in iron such as broccoli, spinach, Brussels sprouts, kale, cabbage, and tomatoes to prevent pallor. Along with these foods, make sure to also consume enough vitamin C for the proper absorption of iron in your body. Number 3. Loss of appetite. You may also lose your appetite if you lack iron. According to a study published in 2020, iron influences the hunger hormones ghrelin and leptin, which regulate your appetite. When you have low iron, your leptin levels rise, and it will cause a decreased drive to eat. Appetite loss is common in young children with iron deficiency anemia. You must have observed powdered milk brands for kids that advertise their product as fortified with iron. This is due to the higher demand for iron in children's bodies, which they need for growth. Additionally, not having enough iron in babies and children may cause malnutrition, whereas lack of iron during pregnancy may also cause premature birth and low birth weight among infants. Number 4. Poor concentration. Decreased concentration is a sign that your body doesn't get enough oxygen, which is transported by the red blood cells. A condition called cerebral hypoxia is the lack of oxygen to the brain, which may lead to cell death every 5 minutes if the brain has low levels of oxygen. Oxygen helps in sending nerve signals from the brain to the rest of your body, and if you don't get enough of it, you might feel lightheaded and not fully aware of your surroundings. Aside from appetite loss among children, decreased concentration may also indicate low iron when kids show signs of poor learning and memory. Children who are unable to pay attention in class may be iron deficient, so consider feeding them with foods that we've mentioned earlier. Adults may also experience poor concentration and other symptoms of iron deficiency, which is why iron supplements are recommended at work to avoid stress and fatigue. Number 5. Cold hands and feet. Cold extremities are a common sign of iron deficiency anemia since there is poor blood circulation in your body. Your tissues are not getting the right amount of oxygen due to your insufficient red blood cells. According to a family physician named Dr. Vikash Modi, your sensation of hot and cold goes away when your tissues don't have enough oxygen. Cold hands and feet, however, may be associated with other conditions, so you have to consult your doctor first before taking medications. Diseases like Raynaud's phenomenon may also be a cause of this symptom due to the overconstriction of blood vessels in the fingers and toes. Similarly, before treating iron deficiency anemia, you should also know its root cause. IDA may either be caused by excessive blood loss, low iron absorption, or lack of iron in your diet. Blood loss such as menstruation and internal bleeding due to gastric ulcers may be treated by iron supplementation or surgery. Low iron absorption may be treated by regular intake of vitamin C. And lack of iron in your diet may be solved by eating meat, seafood, and vegetables that are high in iron. There's a popular belief that lack of sleep may cause iron deficiency anemia. Do you believe in it as well? Tell your opinion about it in the comment section below. Also, if you're new to our channel or have been a follower for some time, come and join the growing family of natural education by smashing the subscribe button and hitting the notification bell to keep you updated. Number 6. Increased heart rate. You may think about it, but this one is not the same feeling you experience after working out. When you have iron deficiency anemia, your heart rate may increase as you rest. Due to the lack of iron and red blood cells, your heart is forced to pump more blood to carry oxygen throughout your body, resulting in a fast and abnormal heartbeat. Aside from this, you may also experience dyspnea or shortness of breath because your lungs overcompensate the oxygen needed by your body. These symptoms may be breathtaking, but they can be resolved in natural ways. After eating iron-rich foods, consume citrus fruits that are high in vitamin C, such as oranges, kiwi, strawberries, and sour grapes, for the better absorption of iron in your blood. You may also want to consider citrus fruits that hit two birds in one stone. Collard greens and Swiss chards are citrus fruits that contain both vitamin C and iron. Number 7. Brittle or spooning fingernails. Due to low hemoglobin associated with IDA, studies have shown that the skin beneath your fingernails may be pale or has no pigment because hemoglobin gives that red color to your blood. Keeping your hair, nails, and toes healthy is another function of iron. Brittle fingernails are also an indicator of iron deficiency anemia, wherein serious and chronic cases may result in spooning of the nails. As the name implies, your fingernails grow into the shape of a spoon, and they break easily too. Number 8. Glossy tongue. This glossy tongue symptom is specific to iron deficiency anemia. It is also called anemia tongue, or in its medical term, atrophic glossitis. The normal tongue of a healthy person is pinkish in color, rough in texture, and has papillae, or small nodules. Any unusual appearance of the tongue may indicate certain conditions or diseases. In atrophic glossitis, your tongue tends to be smooth and glossy in appearance, and it doesn't have papillae anymore. It's also more reddish and is slightly swollen. So next time you face in the mirror, consider checking on your tongue too. Number 9. Cracking of the sides of the lips. A serious case of iron deficiency anemia may also cost your beautiful smile. A condition called angular cheilitis affects the corners of your lips when you lack iron. The sides of your mouth tend to have red, flaky cracks that may even be more painful than having chapped lips during winter. In this condition, you may find it difficult to talk and smile at people. Worse, you may struggle with eating because of it too. And number 10. Unusual cravings for non-food objects. This last symptom may surprise you, but it is true. When you start craving for certain items or objects like ice, sand, hair, pebbles, or paper, you may have this symptom called pica. Pica is common among children ages 2 and above. It may also happen to some adolescents and adults, especially pregnant women. Pica is linked with lead poisoning, which may also cause iron deficiency anemia. Meanwhile, a craving for ice is referred to as pagophagia. Iron deficiency anemia is just one type of anemia that is specific to your body's lack of iron. You can get iron from the food that you eat and from iron supplements. If diagnosed earlier, iron deficiency anemia is an easy condition to treat. If you enjoyed these health facts that we discussed in this video, consider subscribing to our channel for more edutainment content. Perhaps you would like to check our latest video about creatinine side effects and why you should consider avoiding it, or you could find out about the best foods that could improve your mental health and nervous system. Consider checking them out and let us know if you liked it.